Hello, it's Rita at Gold Medical Jobs, and happy Monday. Hope everybody's well. And I wanted to talk a little bit more about jobs for anybody that's thinking about hiring or anybody that's thinking about getting a job in healthcare. That's a big focus for Gold Medical, that healthcare employees and healthcare employers find one another. And so I thought I'd be a little bit specific. We talked about this last time. Last couple of videos, we've been talking about jobs and the availability of jobs in the different areas, whether it be home care, clinic, hospitals. And I wanted to focus on, I'm either sitting too high or too low. Let's see. Sorry. I thought I had it just right. There we go. Let's just move the camera a tiny bit. Hello again. So what I did this morning was just randomly pick two cities. I picked one in the US and I picked one in Canada. And Canada in general, you know, and I don't have the comparison for the United States, but I imagine it's the same or even maybe more so in the United States. But the last recorded information I grabbed pretty quick was that healthcare positions, healthcare jobs dominate between 24 and 26% of the available jobs. So that's a quarter of the population that are being hired in healthcare. So yay, if that's your thing. And that's, hang on. You know, I'm just too twitchy when I have to look at myself in the camera. Sorry. Yeah, I thought I knocked it out. Anyway, so I thought that was pretty interesting that that Canada has a lot of a dominance of healthcare positions, and I imagine it is the same in the US, and I'll talk about that next time I have that information. The top 10 jobs in healthcare in Canada are as follows. More jobs are in nursing supervisor positions, healthcare policy specialist, then you have respiratory therapist, healthcare managers, dental hygienist, great position. I like my dental hygienist. Medical radiation technologist, pharmacist, nurses in general, and occupational therapist and physio or physical therapist. So that's the top 10 healthcare jobs available in Canada. And then I picked a city, so I picked Toronto. And as I said, I was pretty brief. And I encourage anybody in any town to come to Gold Medical. It's a really easy website to navigate. And if you are interested in employing people, follow the prompts for employers. And if you are a healthcare worker, an RN, a medical assistant, a surgical assistant, occupational therapist, a physician, a nurse, please follow the prompts for that. And it is free. You can just become a Gold Medical Jobs member for free. And just follow the prompts on the website, or if you're having any trouble, call the toll-free number. But yeah, Gold Medical Jobs is there for you. We're not an employment agency. We're not a recruiter. We're a meetup site for healthcare employers and employees, okay? And for anyone that wants to advertise to that group, which is in Canada, 24 to 26%. Okay, so let's get back to Toronto. So I went to I usually just lean towards university hospitals as a beginning. There are many private, there are many public, lots of hospitals, lots of clinics. But to just give you a broad idea, just hit the university hospital because you know they're going to train and hire and have pretty much every position in the world at a university hospital center. And so I picked Toronto's University Hospital, and they had 10 pages of mostly full-time, some part-time, 10 pages of jobs, okay? And on page 1, I just looked through the first 3 pages, and I just tell you, on page 1 of those 10 pages, there were 12 postings. Of the 12 postings, 6 were nursing related, and of the 6, 2 were for nursing assistants. One was for nursing assistant in the general and surgical area, surgery department. One was a nursing assistant on the floor. So that's 2. And then there were, was it 4 or 5 RNs? 4 RNs, I think, on page 1. 2 were for full-time. One was part of the resource team, and I think it was just med-surg nursing. And then 1 for mental health worker and 1 for the ICU. So that was page 1 of 10, where the nursing positions dominated. You had 2 nursing assistant and 4 RN positions. And the other ones were in the imaging department, clerical, pharmacy department, dietary, laundry, just jobs, guys. There's jobs out there. So if Toronto's an interesting city, and I think it's a really interesting city, yes, there are healthcare jobs, okay? I picked a city in the U.S. I picked Arizona, which is my next door neighbor since I'm in Southern California, and I picked a university hospital there, and they're known as Banner. And I went to their job site, and they were almost too numerous for me to categorize and list, but for example, in a quick look, I found 4 RN positions, 9 certified nurse aide positions, a chief nursing officer position, as well as many, many techs. They need many, many techs in radiology, and I don't know, there were just lots of tech positions. So dietary was in there as well. But the RN positions, I'll tell you, there was a CNO, chief nursing officer position they're advertising for, a couple of cardiac cath nurses full-time, and at least 3 behavioral. And that was just at a quick glance. So I just wanted to reinforce. So it was Phoenix, Arizona, and Toronto, Canada. Yeah, I just wanted to let you know that if it's a job you're seeking or a job you're interested in recruiting for, please come to Gold Medical Jobs. We'd love to assist you with that. And I wanted to encourage you that the jobs are still there. And each time I come on board for you, I will, you know, I'll highlight something different. So that was just a brief look in Arizona and Toronto. Maybe next time we'll talk about Chicago or Hawaii or something like that, just to, you know, just stretch it out and look in different places. And I know sometimes you have to be patient. I was thinking the need for geri care and a need for home health is always ongoing. Almost always you will find peri-op and OR positions, both for nurses and doctors and for technical support there. The surgical techs are invaluable. The assistants, the first assist in the OR, the nursing assist. There are many, many jobs there. And what else was I seeing? In the home health realm, you think of home health as like custodial and a lot of LVNs for doing wound care and certain treatments that fall in that realm, and pediatric equipment and things at home. But also a huge need is for the home health dialysis techs and dialysis nurses for people that are, wanting to do things at home safely and so forth. They need the healthcare personnel to set them up, to guide them, to sometimes provide the treatment if they have disabilities, to support the family. So dialysis is another huge area to look at if it's something you're familiar with or if it's something you want to branch into. It was actually one of the things I did early in my nursing career. So it's sort of near and dear to me. I have a stool. I have a little stool that somebody made me, and it was my dialysis patient, because I took care of chronic dialysis patients for quite a while, and then I moved into acute and doing them in the hospital and so forth. So you build relationships. And this dear man, he wound up making a stool for me, and then my mother and my mother-in-law liked it so much. We had 3 or 4 stools by Bill, and I don't think he wanted to charge us for it. They're little wooden stools with a nice little rubber mat. I mean, I've had it for so many years, and they're stained and glossed and whatever and sturdy. And I think I insisted on paying him for materials at least, but it was his hobby. He was a retired butcher and a chronic dialysis patient, and just adorable guy, adorable guy. I think I spoke about him once before. Yeah, he drank too much beer and blew out his kidneys. Oh, well. Well, when I say blow out, I mean his blood pressure he had problems, and a sweet, sweetheart of a guy from Long Island, New York. I met him in Queens, New York. So let's see. What else is new? I usually have a Q&A. So I haven't prepared one for you today, but I'll just throw in something a little bit random because we had an issue with one of our pets. We're not really too rural. We're close to town, but we have a big area in our backyard, and it is well fenced, but that's it, the fence. And so sometimes the dogs smell something or dig up something or put their nose to the fence. You know, there's another animal, maybe another dog, or many things. We have coyotes, a lot of coyotes in this part of Southern California, and probably other animals that I don't know. But so one of our dogs sustained a puncture in her face, like here. Her left side. But then she also had something going on here. And to me, that seemed like something, probably she stuck her nose through the fence and something tried to bite her little face. Anyway, so it scared the heck out of my daughter, who's very pregnant. She's towards the end of her 3rd trimester. So she panicked. You know, a little blood always looks like a lot of blood. And what I wanted to say was take a breath, okay? Take a couple of deep breaths, count to 5 or 10, because now I'm dealing with a hysterical young pregnant girl and a dog with some blood. And then you can function a little better. And that lot of blood turned out to be a little bit of blood. And the dog was not trembling. The dog was not crying. She was probably a little traumatized, and she was kind of clamping her jaw shut. She didn't want us to look at it. But as everybody calmed down, it seemed like a little wound here and a little tenderness here, you know, opposite. Let's see, it was left, right, a little. And got a cold cloth, cleaned her up a little, cleaned my daughter up a little, and had a little bit, I don't remember the name of it, but this is, I guess, the point I wanted to make about medicine and Q&As is, can you give an animal your medicine, your over-the-counter medicine, your aspirin or your ibuprofen, your Tylenol, whatever, your non-steroidal NSAIDs, right? Your non-steroidal anti-inflammatory meds? The answer is usually no. No. First of all, this dog is 17 pounds, and I'm well over 100 pounds. So there's that, right? Big difference between a 17-pounder and that. And the chemical makeup of the dog's med is different, and the chemical makeup of the dog's system is different. So they have much shorter intestine, and just everything. I'm not a vet. I don't know too much about veterinary care. So anyway, the dog is doing well. We went to see the doctor. The wound is pretty clean. There was no reason for stitches, and did get her some pain control and some prophylactic antibiotics. She had no fever, and so forth. So, so I guess that was my Q&A. Can you give your pet medicine that you would take? And the answer is no. In most cases, they're just different. They don't use the same kind of sunscreen or shampoo or medicine. So yeah, a little caution and prudence goes a long way in taking care of your pets. And so there you go. It's always great to talk to you, and we'll stay on the quest for jobs. And it's February. It's February, so enjoy winter for a little while longer. We're very fortunate, even when it's cold here, we do get quite a bit of sunshine in Southern California. And wherever you are, enjoy your winter time. And if you're not enjoying your jobs and you're thinking about a different job, come see us at Gold Medical. It's a job meetup site for employers and employees in the healthcare realm. And all the best to you. I'm going to sign off and check in again, and maybe I'll bring my friend Mary by this week. We can coordinate and talk to you. Okay, thanks.